Welcome everyone here today at the 9 months progress report. I'm Dániel Horváth. I'm a prosthodontist and also the first year PhD student. I work at the Department of Oral Diagnostics, and I have my mission, which is to make an artificial intelligence based guide for clinicians that can help to diagnose and treat oral medicine patients. And my mission is to verify artificial intelligence as a reliable support for clinicians, find the possibilities and the limitations of this technique. For achieve my mission and my vision, right now I have two specific goals, and let me introduce my first one, which is the investigation of the diagnostic accuracy of artificial intelligence in oral potentially malignant disorders, and to want to achieve this goal with a methodology of systematic review and meta-analysis. About the background, we need to say that oral cancer is an urgent problem nowadays, because almost 400,000 new cases every year worldwide and almost 200,000 deaths. This is the 6th most common cancer worldwide, and in Hungary the situation is worse because we are the 3rd highest incidence worldwide. The 5-year survival rate is pretty low because we diagnose those lesions in advanced stages. But if we can diagnose the lesions earlier, then the 5-year survival rate can jump up to 80%. However, we have to mention that something going to cause oral cancer, and that could be oral potentially malignant disorder, which worldwide prevalence is a little bit less than 5%. So right now we have an experience-based clinical diagnosis that can lead to diagnostic errors, and we want to aim right now we like to investigate the diagnostic accuracy of artificial intelligence in oral potentially malignant disorders. This leads to our clinical question, which is what is the diagnostic performance of artificial intelligence in oral potentially malignant disorders with the shown PERT framework, and we hypothesize that artificial intelligence can diagnose oral potentially malignant disorders with the same accuracy as histology. Here you're able to see our systematic search key, and we used it for 5 databases, and we had at the beginning almost 12,000 records. Unfortunately, at the end of the day, we ended up with 6 eligible articles due to our strict eligible criteria. We finished our analysis regarding sensitivity, specificity, predictive values, and likelihood ratios, and let me introduce the results. First of all, I have to mention that all of the articles investigated more than one artificial intelligence-based diagnostic tools, and because of the overlapping population, we proposed the best sensitivity ones. So right now you're able to see the best sensitivity, the artificial intelligence-based tool with the highest sensitivity. So we can say right now that the sensitivity of the AI is 0.93 and the specificity is 0.94. But we have to compare it with the general practitioners also and the experts to evaluate these values. And we can say that general practitioner, if we compare these results with the general practitioners, we can say also the sensitivity and specificity is clinically relevantly higher and also reach the mathematically significance level. And if in the case of the specialist, this is the same situation with the sensitivity. Here you're able to see the predictive values and the likelihood ratios. I need to mention, if we just take a look at the positive predictive value, we can say the values are way higher at the study level than the overall level. That's because the study level positive predictive and negative predictive values was calculated with the prevalence of the disease within the study, and the overall was calculated with the worldwide prevalence. On the right side, we're able to see the likelihood ratios. which is not influenced by the prevalence of the disease like the predictive values does, and we can see that the positive predictive values is above 20, which considered a pretty strong correlation between the positive test results and the disease, and we can see the negative likelihood ratio is below 0.1, which considered a strong correlation between the negative result and the absence of the disease. And, we have strengths of the studies because we have a lot of amount of pictures. All the pictures was biopsy proven. All the architectures are well described, and we know everything about the teaching methods. We have also limitations because we have low number of studies. The different amount of teaching pictures was used within a study, and same teaching settings was used in a study for different architectures. Our conclusion is that artificial intelligence can diagnose oral potentially malignant disorders on intraoral photos. Our implication for practice is that artificial intelligence-based diagnostic tools will be used for a non-invasive screening tool of oral potentially malignant disorders, and that can cause less burden on special care. And on the research side, we can say we need to develop freely available oral potentially malignant disorder picture database to develop new architectures, and we have to improve the quality of multi-class classification models also. So right now we are at the manuscript writing phase. I'm right now writing the second version of it and waiting for my supervisor response, and we try to submit our manuscript in the Journal of Dental Research. Let me introduce my second project, which is to investigate the diagnostic accuracy of artificial intelligence in oral lichen planus on histological images, and it's going to be an observational cross-sectional study. Oral lichen planus this is the most common oral potentially malignant disorders, with the prevalence around 1% in the general population. Right now, it's a clinical pathological diagnosis, which means that we need the clinical features and the pathological features to diagnose those patients. This is always a decrease in quality of life, and we have to know that these lesions are treatable with the adequate therapy. Right now, we know that we are humans. We make mistakes due to the high inter- and intra-observer variations. According to the study, the agreement among pathologists was only good with the shown Cohen kappas. And we provide artificial intelligence as a reliable tool, the same performance every time, no tiredness, and no external influence factors. And our aim is to investigate the diagnostic accuracy of artificial intelligence in oral lichen planus on histological images. That leads to our clinical question, that is, what is the diagnostic performance of artificial intelligence in oral lichen planus on histological images? We use the PERT framework, and we hypothesize that artificial intelligence can diagnose oral lichen planus in shorter time and with higher accuracy. And our clinical implication would be more accurate diagnosis. So about we are at the planning phase of this trial. We gathering histological samples. We have around 250 whole slide images. We're going to digitize those whole slide images. A specialist is going to re-evaluate all the slides, and after that we're going to calculate the teaching, the validating, and the testing samples, and teach, validate, and test the AI with these samples. So in summary, I can say both of my ongoing projects is related to oral medicine, especially to oral potentially malignant disorders and artificial intelligence. I plan to submit my first manuscript in June. And I would like to thank your attention with the quote of Albert Einstein: "Try not to become a man of success, but rather try to become a man of values." Thank you for your attention.
I have a question regarding your first project. Was it possible for you to subgroup the malignant or potential malignant lesions? Because I would assume that some of them might be easier to diagnose also for clinicians and then also for artificial intelligence?
Thank you for your question. We plan to subgroup, but because of the low number of studies, it wasn't possible to make a subgroup analysis. And the other reason is that the eligible article, not all the eligible articles specify which kind of oral potentially malignant disorders they investigated in the study. Yeah, so that was the reason for it.
I was wondering whether any of the analyzed AIs are publicly accessible and or free to use.
Okay, so all of the architectures are, so the base of the architecture are free source, so we are able to download those and use, but it always needs a modification to specify an architecture for a specific project. So we need to have a huge knowledge in this field to use those to teach those architecture to a specific goal.
You mentioned artificial intelligence, but what type of artificial intelligence do you use, if you could answer that?
Thank you so much. So all of the eligible articles used convolutional neural networks, which considers as a deep learner architectures, and this is the most common one nowadays that is used for picture analysis.
So it's basically with neurons, right?
Yep.
Okay, thank you very much.
I'd like to know if the purpose of the second project is in the end to create like an application for helping dentists to diagnose it.
So basically the second project going to, in our vision, is going to help mainly for pathologists, and secondly for the practitioners and the experts on the field, because if we have the proper diagnosis due to the histological analysis, then we can treat the patient with the adequate therapy. And yeah, so the main help is going to be at the histological side.
What kind of architecture, what kind of AI are you planning to use?
Okay, so we have a huge connection and collaboration with the Ankara University in Turkey, and they propose to have an architecture regarding image analysis that was already used in intraoral images. And they're going to modify this architecture to be able to analyze histological samples.
Sorry, I didn't hear you. So it was already used for histopathology?
No,
images?
not yet. Not for histopathology, but for intraoral images.
Intraoral images. So basically photography.
Yeah.
Thank you very much.
And I have a question from your first project, that when the population was the patient with intraoral images, did you make difference that where these images came from, so from intraoral scanners or from digital cameras?
All of the pictures was taken with intraoral cameras or smartphones, so none of the pictures was made with the intraoral scanners.